is Catherine with OSUIT Nursing. I'm going to demonstrate how to initiate an IV infusion and to change the IV tubing. So the first thing that we've got to do is make sure that we have an order to begin an IV. So this patient already had an IV site. I do have orders now to begin IV fluids. So what I'm going to do is go into the patient's room and introduce myself, make sure that I have the correct patient. I will also explain to the patient what I'm going to be doing, answer any questions that they have. The patient is fine with starting the IV fluids. So I'm going to look at the IV that I have. If you do not already have an IV site, then you'll have to start an IV. So, but right now we have one. With this IV site, there's actually a cap on the end of it, and it is alcohol impregnated. So whenever the IV is not being used, they will put this cap on there to keep it covered with alcohol. So when you take that cap off, you don't have to wipe it off with alcohol again because it's already been setting in alcohol. If you do not have this cap, then you will need to take an alcohol swab and clean the end of this cap here, the end of the IV site, for 15 to 30 seconds, and then let it dry before you actually connect any tubing. So we have our IV site, so what I need to do is go ahead and start my IV. This is IV fluids. They may look a little bit different between different companies. This one has a pull tab that comes right off. Some of them has a pull down tab that comes off, but each IV fluid will have a port with a cap on it so that you can actually insert tubing. So this one has a port cover like this. So I'm going to pull that off. You have to keep this end sterile. If it touches anything, then you've contaminated it and you have to get a new one. With this is our tubing. I will pull my tubing out of the bag. I'm going to go ahead and clamp it by using my slide clamp, but you can also use the roller clamp if you'd rather, either one. I'm going to take the tip off of my spike here, and then this is what I'm going to insert into the IV catheter, to the IV fluid. So I'm going to turn it up, and I'm going to fill the drip chamber about halfway full. So this will allow me to see if the IV is dripping, but if you have too much fluid in there, then you won't be able to see the drip. If you have too little fluid in there, you could get air in your line. So it usually right about halfway through is full is a good height. So now I'm going to hang my IV fluid here, and I'm going to prime it. Priming means that you're going to get the fluid to go all the way through the tubing, and you want to try to have as little bit of bubbles in there as possible. There's sometimes very tiny bubbles that will be in there that you cannot get out, and that's fine for those, but you don't want to have any large pockets of air. So you try to get out all of them that you can. So being careful not to touch the IV tubing to the floor. I'm getting it to where it's not tangled, and now I will release the clamp and go ahead and prime the tubing. There are some tubings that you have to take the cap on the end off in order for it to prime, so whichever type you have is how you'll have to work with that. You can drain it into a trash can, or you can, if you've got a sink nearby, you can use that instead. So whichever one works best for you. Okay, so you can see here I've got some big bubbles. There's a bubble there, a couple bubbles there, another one there. So I'm going to keep priming it until those are out of there. Okay, so now my bubbles are out. Check the line and make sure there's not any more that I didn't see before. So now we're going to go ahead and connect it to the patient. So with this one, I've got the alcohol cap on there, so I don't need to use any alcohol on it right now. I will go ahead and connect this. And depending on how it's lying with the patient, you may need to secure the tubing also, just depends on how secure it is. So then at this point, I would put my IV tubing label on there. This is a label that tells you how often to change the tubing. Generally, it's going to be about 72 hours that you will change IV tubing. On this tubing label, there is your initials, the start date and time, and then the time that you're supposed to change the tubing along with the dates. So I'm going to wrap this around the tube. So every nurse that comes in after me for the next 2 and 3 days will be able to look at this and see if it's time to change the IV tubing or not. At this point, we would go ahead and connect it to the pump, or you would count the drops per minute if you were doing infusing the IV by gravity. But right now what we're going to do is we're going to change the tubing. So it's been 3 days, 72 hours. It's time to change the tubing. So we will clamp it off and disconnect it from the patient. If there's any chance that you're going to come into contact with any bodily fluids, you should wear your gloves. I'm going to take this down and I will get my new tubing. You could actually open your tubing before you even take the IV down if you prefer. I'm going to clamp the new tubing, and make sure that you do not let any of the tubing hit the floor. I'm going to remove the old spike out of the drip chamber and discard it. Take the spike off of the new tubing and insert it into that same port. And then you're going to prime it the same as you did whenever you initially started an IV fluid. So I filled my drip chamber halfway, now I'm priming. So I had an IV tubing that was connected to this IV site, so now I actually need to clean it with alcohol. I'm going to go ahead and flush with some saline just to make sure it's still a patent IV site, so I'll release the clamp on the IV catheter. If it is clamped, and while I'm flushing, I will make sure to watch for any swelling or redness. If it's cold and clammy or cold to the touch, then you will need to start an IV, another IV. Patients will often complain of just a quick bit of discomfort whenever you're flushing it due to the saline being flushed, but it shouldn't continue. I will now take off the cap on the end of the IV tubing and go ahead and connect it. And at that point, I would go ahead and either set it to whatever drop rate that it needs to be, or else I would connect it to the IV pump. Last but not least, place a new label on for the IV tubing so that the next shifts will know when it needs to be changed. Okay, so that is changing out IV tubing and initiating IV fluids. You would go ahead and lower the bed down into its lowest position. Make sure the wheels are locked, side rails are up ×2. Call light is within reach, the personal belongings are within reach. Clean up all of your supplies and make sure that the IV pump or IV pole will be on the side of the IV. You don't want them walking over or having it over on the other side if they have to be getting up. So once you make sure that they have all their patient safety measures taken care of, and you make sure that they don't have any complaints, you go ahead and are leaving the room, perform your hand hygiene, and then you're done. Thanks.